Hi everyone, I'm Dr. Gustavo Coutinho. The goal of this video is to describe a surgical technique of removing subepiglottic cysts in horses via the oral approach under endoscopic guidance in the dorsal recumbency. We have no conflicts of interest to disclose, and I want to thank the WSU Anatomy Lab for the help.
Subepiglottic cysts are fluid-filled sacs that form beneath the epiglottis and the larynx of horses. These cysts can cause respiratory problems and even aspiration pneumonia, particularly in young horses. These cysts are a relatively uncommon cause of upper respiratory tract noise and exercise intolerance in horses. They primarily manifest as respiratory noise during both inspiration and expiration, especially during exercise. They form beneath the epiglottis, distorting the normal architecture between the larynx and pharynx. These cysts may contribute to coughing, swallowing difficulties, and even aspiration pneumonia. This condition, often detected via endoscopic evaluation of the upper respiratory tract, is most prevalent among young thoroughbred and standardbred racehorses. Although their exact cause remains unknown, it is thought to be congenital, with cysts arising from a remnant of the thyroglossal duct. This is a comparison of the same horse at two different speeds on the treadmill. Note that the cyst is not as visible on the first image, but becomes evident on the second. Note that the speed of the horse is important in this evaluation. The oral approach in dorsal recumbency is a minimally invasive technique commonly used for the removal of small subepiglottic cysts. It offers the advantage of maintaining the cyst in a position above the palate for easy manipulation and excision. This video demonstrates the use of an electrocautery snare connected to a standard electrosurgical unit capable of providing bipolar electrocautery. The settings used were 100 watts, and adjustments were made as needed during the procedure. Those are the specifications of the material used to perform the procedure described. You can pause the video here and take notes about the equipment. A nasotracheal tube is used to keep the horse under general anesthesia in dorsal recumbency. The modified vaginal speculum facilitates access to the oral cavity and throat, serving as a retractor while providing protection to soft tissues and ensuring a consistent pathway to the nasopharynx. A flexible endoscope and a bronchoesophageal forceps are passed through the speculum, and then the forceps are used to grasp the mucosal surface of the cyst and rotate it. The Chambers catheter is introduced and used as a guide to the snare. The cautery loop is directed to the larynx using a Chambers catheter placed around the base of the cyst and tightened. Cauterization is achieved by using the electrocautery snare to cut through the base of the cyst. After the removal of the cyst, it is necessary to check the position of the epiglottis to ensure normal anatomical position is present. Here, we have a cadaver simulation of this procedure to clarify the steps. This cyst was created in a normal horse after euthanasia for reasons unrelated to this study. Firstly, the loop should be placed around the forceps before entering the speculum and introduced through the mouth of the horse. Once this position is achieved, we use the forceps to push the other side of the loop through the base of the cyst and tighten the loop around the base. The cautery is then activated to remove the cyst. Big cysts can be drained before the removal using a sclerotherapy needle. The cyst lining is then pulled out through the mouth, and the surgery site is left open to heal via second intention. Use the lowest effective cautery setting to minimize the risk of thermal injury to the mucosa and surrounding tissues. We started at 100 watts using bipolar electrocautery through the snare in blended cut mode, adjusted as needed, at intervals of 5 to 10 seconds until the mass is separated from the underlying base. Oral phenylbutazone 2.2 mg per kilogram twice daily for 7 to 10 days and rest for 30 days before fast work is crucial in postoperative care. Steroids seem unnecessary since the animals didn't present excessive swelling of the respiratory tract in our experience. Both clinical cases presented in this video had a recovery within the normal limits, without recurrence of the respiratory noise. Preoperative penicillin and gentamicin were used. Continue with sulfus on the rare case where complications are noted. Close monitoring during the recovery period is essential to ensure a successful outcome. That concludes our video demonstration of this surgical technique. We hope this has provided valuable insights for equine surgeons undertaking this procedure.